Hi everybody and welcome to another episode with the Anxious Resistance. Today I'm talking about a medication known as Sertraline or Zoloft. In 2016, Sertraline or Zoloft was the most commonly prescribed psychiatric medication in the United States. And in 2019, it was the 12th most commonly prescribed medication in the United States with over 37 million prescriptions. So this is a very commonly used medication. It is an SSRI, so it is a first-line treatment for anxiety and depression. Sertraline was first approved by the US FDA in 1991, so it's been around for a few years too. 31 years. Sertraline has been approved to treat conditions such as major depressive disorder, obsessive compulsive disorder, post-traumatic stress disorder, premenstrual dysphoric disorder, panic disorder, and social anxiety disorder. Sertraline is not approved for use in children except for those with OCD. Now, sertraline has been around again for about 31 years. It's very commonly used. Many people have heard of Zoloft before. So some of the side effects of this medication include anticholinergic effects, so dry mucous membranes, dry mouth, constipation. You also get other conditions like fatigue. You can get headaches. You can get brain zappy-like feelings. Just to name a few of the side effects. My advice when it comes to psychiatric medications is that you don't focus on the side effects. In fact, just know what the bad ones are and disregard the rest, see how you do. For me, you just need to know that antidepressants can make things worse. So you need to watch out for that. You need to see if your depression suddenly, increasingly gets worse and you have an increase in suicidal ideation, as that may be the medication, and it's something you need to watch for. Now, Zoloft is a good medication. It blocks that serotonin reuptake transporter. So what it does is it allows that serotonin to stay in the synaptic cleft, which is that space between two neurons. The higher the level of serotonin in that space, the better you feel. Now, you can get too high, and it can lead to a condition known as serotonin syndrome. But you have to have really high doses of SSRIs, and it's usually a combination with other medications like trazodone or a tricyclic antidepressant or even an atypical antipsychotic that increases that serotonin. So if you're on an antidepressant alone, you can watch for symptoms of serotonin syndrome, but it's not very likely. When you have that increase of serotonin in that synaptic cleft, you feel better and you have more energy. And when you have low levels of that, that's what leads to depression and low mood. So like with other SSRI medications, Zoloft can have sexual dysfunction side effects. For men, it may lead to a difficulty in having an erection. In women, it may lead to not being able to have an orgasm. So that's something to be aware of, and it can be treated with other medications to help relieve that side effect. Or you can also try another medication of the SSRI class or other classes of medication so that you don't have that symptom. With Zoloft, it can be 1 to 2 weeks before any effects of the medication are felt. Full potency may not be felt for up to 6 to 8 weeks. So this is a medication that you need to be patient with. And also, as far as side effects go, you need to be patient with those as well. Side effects, if they're not serious, if you're having some headaches, maybe a little fatigue, maybe a little bit of body aches or something, they tend to relieve as your body adapts to the medication, as it gets used to having it, as it builds in your system. So be patient. Side effects tend to go away. It may take some time. It may take a couple of months till your body really gets used to the medication. It may take even longer, but be patient. You always want to give these medications a full try. You want to start at a low dose. You want to raise it higher and higher till you get to the highest dose. And if you can tolerate the side effects, if you need to get feeling better, you can get to those higher dosages. But you want to give each medication a good try, because you don't want to have to come back and repeat it later if you're not getting enough relief from other antidepressants. You want to make sure you get at least to that 8-week level, or it's kind of evened off and plateaued in your system, so that you can know how it really affects you. If you have any questions about Sertraline or Zoloft, please comment them down below. I will answer them to the best of my ability. Again, I am a psychiatric nurse. I do work in a psychiatric setting. and I dispense these medications and I work with them a lot. I see them prescribed all the time. So I have a lot of education and background about them. And I also have a lot of personal experience to draw from. Thank you so much for watching this video. If you enjoyed it, please like it. If you want more content like this, please subscribe to our channel. We put out content like this all the time about medications, treatments, anything to do with mental health. And thank you so much for watching.